Manever I say ma PENDREAM TV. PENDREAM TV there, I see them yopo.
All right. First of all, let me say a very good morning to the affable, humble, and solution-seeking Dr. Mahmoud Bawumia, the one who will take over when JM is done serving this country in 2029 January. Interestingly, after having saluted my president in waiting, let me quickly say that it is a very nice coincidence that my presentation will capture a speech he gave in 2024, which touches on what we are discussing this morning. But to start with, let me say that there are some good things and commendable things about the efforts by this government to throw light on prevention and promotion. So, in fact, there are so many subjects, so many ministries. In every ministry, there are so many departments and issues to be dealt with. So for the president to give attention to the health sector, and then not just the health sector, but go into prevention and promotion and talk about it and throw light, that is commendable. Because as health advocates, we are happy when the first gentleman is talking about our issues. It means that it will get attention. And remember, when a politician gives you attention, more of it than not, it comes with financing. So that is commendable. The second thing that I also want to say is a good thing is that it's a fact that the National Health Insurance Levy, the money that is collected, and let me take the opportunity to salute President John Ajekun Kufuor. From 1957 up to 2003, the leader that we've had in Ghana, who was able, with all humility and hard work, craft a very comprehensive, self-sustaining health financing program or law, is the National Health Insurance that was introduced through that act.
It didn't start with you. It didn't start with the MPP.
Oh, I'm coming. I don't want to go.
Okay, all right.
You see, I heard all those debates.
Yes.
The substance, if we are being candid with ourselves.
Right.
The one that made it possible for you to pay a levy, about
Right.
2.5% or so on every transaction, and go into a fund that was significant to pay for the sicknesses and illnesses. It's the NHIS program.
No, I'm talking
I
about
hear people say
I'm talking about the idea.
Look, the idea, but the idea of financing health
Health.
has been there from Nkrumah's time. In fact, when you read on health financing, health was free before Nkrumah became prime minister, and was free up to 66.
Yeah.
When he left, in fact, we were having a little bit of, our economy the strength was going down. By the time Ankara, how do you call it, and the rest came Buzia, we started having user facility fees to support the program. And user fees became very big issue and expensive during Rawley's time, until Cash and Carry and Kufuor said, look, let's do something.
Right.
So the point I'm making is that it is important that we celebrate the tradition and the leader that said, look, enough of this pay at the point of receiving care. Let's fund it through a social program.
To cash and carry.
Yes. Now, so over the years, for some reason, because governments always have pressure on them, from President Kufuor's time, the amount allocated, so when the levy collects the amount, the finance minister, and the law says all monies must go to the finance minister. From President Kufuor's time, nobody has had 100%. Usually, when you go and check, maybe Kufuor's time, 80% of the money. So when they collect, let's say, $1 billion, 800 million comes to NHIS, and some 200 million will support a few things at the center. And when President Kufuor was in charge, Ken was also not releasing 100%. In fact, it was about, I start to recall it, about 65 or so, but it grew over time. And I can confess here that I was instrumental in working with the World, the IMF and the World Bank. So through some of our contributions, they made it part of our program that our monies must be disbursed in huge amounts so that they can qualify for further disbursements. So to be honest, my brother Jokoto and Dr. Bampo are doing a fantastic job with payments. But when you ask the providers, it improved significantly before we even handed over. When I was there, And all is because the amounts coming were in good amounts. But the fact is that under President John Dramani Mahama, the commitment is that all capping, all monies that were taken should be stopped, or should come to the National Health Insurance. So that is a fact, and that is commendable. Some of us were saying that if you are giving all the money to health insurance, nobody needs to pay anything in this country. So, in fact, out of most of the promises that JM and my brother Jokoto promised, the one they've honored is this: will remove the cap from.
You know why he's commending you, Doc? Because even when his party was in government, he was respectfully of the opinion that those funds must be freed.
Yes.
Yeah. So he's been consistent.
So I've marked him 9/10 on moving the cap. I'm giving the high marks first. So that when I go to
well,
another
can't
one,
you continue to your end? You can't promise.
Yes. So I'm giving the high one first.
Right.
And then also, psychologically,
Yeah.
when people hear that something is free, it has a way of stimulating interest.
Yeah.
So to say that this free primary health care, you can go and check your pressure and things, you don't pay anything. The psychological effect, and I'm saying psychological because I'll come to the reality.
Right.
The psychological effect is also commendable. Now, that is also correct. Then there's an aspect, I've read through the whole document. There's an aspect that talks about population-based financing, where, let's say, when you take Accra, the program can allocate, let's say, 1 million Ghana cedis to Accra. And Lechukuku might get, let's say, based on our population, we'll get, let's say, 40,000 Ghana cedis. And a smaller community constituency might get, let's say, 10,000 Ghana cedis. To do population-based is correct, so that there is not equality, but equity. Now, the good thing also about this population-based promotive, like financing for promotive and preventive care, is that when you take a community, the voter region, let's say you take a community that there's a lot of farming, let's say Lake Levi, I like them because of the coffee. If the issue, one of the health issues there is snake bites, then you can now have a program on educating the farmers on how to avoid snake bites using some of this funding. Right. Instead of waiting for someone to be beaten to come, And sometimes the health officers, they know that the education is necessary, but they might not have the funds to go and do and all that. So to allocate this funding out of the amount for 1.2 billion for this is also commendable. You understand? Now, let me quickly educate our viewers on the difference between the free primary health care, what appears to be the difference, and what we have, what they inherited. So I realize that there are some few things that makes them say this and new one. In form, it might look like it's new, but with all honesty, in substance, it's almost like the same. But I don't really mind when someone calls something a different name after throwing energy at it. Energy is good sometimes to let something which is not active come on board. You understand what I'm saying? So, first thing is that with the free primary health care, if you go to Teshi Community Clinic this morning, and you are not a registered member of health insurance, national insurance, but you have a Ghana card, and you have a headache, they will treat you, do a lab for you, do the consultation with your Ghana card, give you medicine, and you have been treated. Listen carefully. With the free primary health care,
okay.
Teshi Community Clinic, they say you can go to places up to polyclinic. So if you go to Lekma Hospital, it's not part.
Yeah.
Lekma is, although it's big, it's at the level of a district hospital.
Right.
So this free primary health care say that any small place you go, up to polyclinic, if once you show your Ghana card, you get a care.
True.
So when you go to Teshi Community Clinic and you appear there and you have a headache and you are not on NHIS, when you show your card, they will take care of you. Now, the one who comes but has an insurance card, the difference between you now and that person is that the insurance guy, assuming he's not a SNIT worker, is an informal worker, would have paid premium of, Doc, how much is the premium now?
It's a token. Yeah, it's a token.
It's a token.
20 CD.
Okay.
So it is that 20 CD that has captured the one with insurance card on the system. And so when you get the care with just your Ghana card, you have a 20 CD advantage over him. Let's grant it.
Yes.
That he paid 20, to be honest. You have not. The one who is having just Ghana card, maybe, listen carefully, if there had not been free primary health care, he wouldn't have come to the facility.
Right.
So the good thing is that he has come because he is unwell, has a Ghana card. So that's where the free comes. But the interesting catch, I'll come to the interesting catch. So this is a clear difference. Both are taken care of. In fact, when you go to the back end, both would have their service paid for by national health insurance. But the interesting thing is that the one with the NHIS card, when you go to our budget, the formula, I say our because I see myself still as a friend of NHIS. The money for paying the NHIS guys malaria would have been at the claims payment line, the amount of money for that year.
True.
Whereas the one who came with Ghana card, it will be at the line where they're getting free primary health care. Because there's 1.2 billion in the line, NHIS monies, 1.2 billion has been allocated for all these people who come in this category. So the same NHIS fund in the budget of the NHIS as an organization, an authority, is paying for both people, but one is in the system, the other is not in the system.
I get it.
And the good thing, which I will give them, is that the guy who is not in the system, maybe because he's not in the system, he would have avoided the clinic.
Yes.
Please, you understand?
Yes, because I don't have a card.
Exactly. Another difference is that both don't pay. All are paid by NHIS. But remember, the guy on the system paid some 20 CD premium when he was registering.
True.
Which this guy has not paid.
Yes.
Now, another difference. Ghana Health, the status quo before they came. Health insurance pays for your claims, your bills. They don't pay staff and volunteers and all that. This program will be paying people who are like health workers going into community. In the past, we still had community health nurses, community health officers, but they were staff or they come under Ghana Health Service.
Okay.
Yeah, we have a whole unit called health promotion. Unit works with the service.
Right.
Okay, so those things have been happening, but this time through the free primary health care, once it's in the NHIS budget and there's an amount, some of the amount will pay for the care, that's the claims. Some also will pay for allowances for those who are in the field and all that. And some also will pay for procurement, another difference, of some equipment. And if you had used the old system, NHIS will not be procuring equipment from its budget for hospitals and all that. But through this primary health care, it's possible that some CHIPS compound will get some maybe sterilizer machine or something as a way of strengthening them.
Okay.
Please, you get a difference.
I get it.
Another difference is that before they came, we had a program trying to support health promotion and prevention like they are doing. The amount was, I think, 3 or 5 million. The one we put in the last budget before they came to support it. It was not 1.2 billion. Obviously, that amount I don't think was going to pay volunteers and all that. It was going to depend on the structure and people that Ghana Health Service has. Because when you go to our communities, you have nurses who go and do immunization and all that. I think one thing that I also have to say so that it comes to mind is that most of the prevention and promotion programs were being handled by Ghana Health Service, which is an agency under Ministry of Health. NHIS largely was looking at the curative care, paying for it. So it was like division of labor. Just before transition happened and President Mahama came, most of the partners who were financing the prevention and promotion programs under Ghana Health Service started to withdraw, or funding was diminishing over the years. So what this government did was that after letting all the money go to NHIS, they intelligently told them that now support these programs whose funding have what? Been diminishing or gone. So we had, as a country, some of these departments and activities. Previously they were being funded by USAID, JICA, sometimes the Holland, Dutch government and all that. This time, we are more or less allocating money from National Health Insurance Authority and paying into this pre-primary health care, which is essentially going to work with some of the people in these departments. Right. They might recruit a few volunteers, but largely it's going to these departments to make sure that they receive energy. If we had not channeled money there, or the funding from those partners were not coming, the activities would have gone down. So National AIDS Control Program, the activities they were doing, they were promote health promotion. But it was not NHIS. Right. And how do we call it? Reproductive health, safe sex, all those education programs. They are all health promotion to make sure people don't get into teenage pregnancy. Yeah. All is health promotion. TB program in Ghana. Yeah. The National Malaria Program. All those programs were doing sharing mosquito nets. They are all health prevention and promotion. Right. But what we are doing now is now have a line from National Health Insurance paid for through insurance levies But the authority will disburse the funds. And by the way, all this time, 10% of insurance money has always been sent to Ministry of Health to support Ministry of Health program.
Oh, okay.
Before today, all the time. So when health insurance collects, let's say, 5 billion Ghana cedis, 500 million is sent straight into MOH account. That is how we've practiced. That's what we've practiced from President Kufuor up to today. So the point I'm making is that NHIS sending money to Ministry of Health or to programs supporting the health architecture started some time ago. This looks like another line which has been added. More you hear what I'm saying?
I get it.
And then finally, let me say that there are some recommendations that I have. Some thoughts, things that we can think about. The guy who came to the clinic at Teshi community with a Ghana card and was taken care of by the free primary health care. If his condition deteriorates, if he takes his malaria medicine, but he's not getting well, and he starts to get unconscious, like very sick, weak, and cannot move, the free primary health care cannot take care of him anymore.
True.
Once he's admitted at LECMA, he must pay from his pocket.
Yeah.
So what we must be doing, very crucial, is that anyone who comes with just Ghana card to get benefit from this free primary health care should quickly be registered on the National Health Insurance.
That's a good idea. That's a very good suggestion.
So that next time when it comes with his Ghana card, and the interesting thing is that when we were there, we started to register you not with Ghana card and NHIS card. Your Ghana card, because of the software, is what we use to put you in the system.
Yeah.
So your number will be on the system as registered.
Right.
Every Ghanaian who comes the first time should not come the second time as a free primary health care beneficiary again. Your first one should capture you.
Right.
The advantage again which the free primary health care has, which is again one we must give it to it or commend it, is that if you register for NHIS today on the system, it will take 30 days before you can use the card. But with this free primary health care,
like this instant.
yes, with the Ghana card, they will take care of you over there.
Yeah, but Okoe, the gentleman who has gone for medical services through the free primary healthcare program. Your suggestion that a person must be captured under the NHIS.
Yes.
Right?
Yeah.
So that they don't return as a free.
The second time, yes, they should not be free.
But that person has to pay a premium. Has to pay some
So I'm coming there. So this is crucial for us. When he came the first time, listen carefully.
Yes.
His malaria treatment, consultation and medicine cost, let's say, 200 Ghana cedis, which will be paid for from health insurance under the free primary health care line.
Yes.
Why are you going to spend 200 Ghana averagely when it comes, when you can use 50 cedis, a quarter, to register me on the line?
Okay.
If you will not come in the system because of money, register him and pay for him.
For free?
Yes. The 50 is cheaper than the 200 you just paid for malaria. Anytime he comes, you are paying money which could have been cheaper. What kept him away is that token of 50 cedis. He didn't pay. If you are willing to pay his condition, 200 cedis for him, then quickly transition and pay.
Won't that then discourage people from...
No, I'm coming. So as a country, it is growth. We started by educating people that insurance is important, register.
Yes.
We realized that there is some 36%, like you said, who are not coming.
Yes.
If they will not come, find ways to. So before this new government came, we were finding ways to rope them in. You know, sometimes I said I was giving some scholarship to some football teams. People thought I was going to buy jerseys. What I was doing smartly was to make sure that all the footballers and all their supporters, I told the teams, give me like 4,000 or 5,000 people connected to your team. We will pay to register all of them on the insurance.
Oh.
So if it's 50 cedi per head, we will take the cost.
Right.
Guess what? When they are sick, it is insurance that pays using the health insurance package.
I get it.
So there's been efforts in the past to pay for people so that if they will not pay, because the money, to be honest, the money is not a deterrent.
Yeah.
When you see that someone has not paid, it's because their health-seeking behavior is poor.
Yeah.
That's how we call it public health. They just don't care. Look, in this country, 20 cedi or 25 cedi for a year, with all due respect to headquarters, they can pay
if they want to.
If
they want to, they will pay.
So the point I am making is that we must make sure that everyone who comes the first time as a free primary health care beneficiary does not return the second time. In fact, if you don't do that for him, he will be comfortable with this measure. The next time when he gets to Lekma, he might think it's the same thing happened. They will tell him, we are sorry.
You have to pay.
Your free primary health care ended at
here.
a polyclinic. So this is it. And then, Moro, let me conclude by reading a paragraph from Dr. Mahmoud Bawumia. When he launched, we did some annual health check at National Health Insurance. And there was a statement. He said what? And I think largely what this administration is doing, my brothers, Sen and Udems are doing, is to more or less advance what we try to also start in terms of promotion. Now, he said Ghana has committed, just a second. Yes, so he said the free annual health check program, why is my phone trying to? Yes, all right. So, ladies and gentlemen, this is from Dr. Mahmoud Bawumia on this 29th July 2024, speech by His Excellency the Vice President of the Republic, Alhaji Dr. Mahmoud Bawumia, at the launch of the free annual health check and innovations at the NHIS in Accra. Now, he said, ladies and gentlemen, his opening paragraph. Since Ghana's independence in 1957, conscious efforts have been made by governments to address the healthcare needs of Ghanaians through various mechanisms aimed at lowering financial barriers to healthcare for our people. Now, he says that over the past 20 years, the NHIS has grown in leaps and bounds with its active membership standing at 17.8 million. And then I want the paragraph that talks about, yes, he said, it is an honor to stand before you today, Muro, to launch yet another, your name was not in the speech, to launch yet another pivotal initiative that marks a significant milestone in our nation's healthcare journey called the Free Annual Health Check Program. This program is a collaborative effort, and I see some parts similar to what President Mahama read, so it's a continuation. This program, a collaborative effort between the National Health Insurance Authority, the Ghana Health Service, Christian Health Association of Ghana, and private healthcare providers, underscore our commitment to ensure that every Ghanaian has access to comprehensive and preventive health care as part of NHIS benefits package. And then he said that the free annual health check program is the first phase and short-term strategy for the implementation of the health preventive and promotive benefits package. Moro.
Okay.
The free annual health check will provide the opportunity for all Ghanaians 18 years and above, irrespective of whether they are enrolled in the NHIS or not, to access a defined package of preventive and promotive services at any time during their birth month at a specified health facility. The services to be enjoyed in this package will be screening for blood pressure, screening for blood sugar, screening for BMI, body mass index, counseling, and etc. So this is just to say that I commend them for the renewed energy. But with all due respect, a lot of work was started when we were there on preventive and promotive programs.
Okay.
And like I said, because NHIS ultimately is the one, there's a difference. The NHIS, the authority, the National Health Insurance Authority, you know the law that established the NHIS, established three things in that law.
Right.
The Act 650, later 852. One is authority, which is supposed to regulate health insurance, medical insurance in this country. The other one is the fund, which is the collection of the levies.
Right.
And then the third one is the scheme.
Right.
Right. So it is authority that is paying for both the NHIS member and a free primary health care beneficiary. Okay. It's the same source. Right. All right? Right. So my point is that because it's the same source, let's make sure that the Ghanaian who comes because he had free is captured in our system, so that wherever level he goes, he can receive care.
I think it's a fantastic suggestion. So.
PENDREAM TV. Now, so far so good. Say open online portal in Ghana. Nipa share, nipa follow, nipa comment here. To my best of knowledge, without any biases, PENDREAM TV.